Thank you for staying with us here at IKD 106.1 FM. And yes, it's another Thursday morning. Clockwork from our studio, exactly 4 minutes past the hour of 11. And you already know that every Thursday, such as this, we have healthy conversations. This is in line with General Hospital Ikorodu, helping us to understand how well to take care of ourselves, how well to stay healthy as individuals out there, as adults, as children. Today is another very beautiful time on radio where we would have this fantastic segment where you and I will learn from. So I therefore crave our indulgence to be a part of this conversation while we talk about skin cancer prevention and treatment. Many a times, a lot of us are ignorant when we talk about our skin, and many people do not tend to look at the angle of skin cancer as a major problem in this part of the world. But today, with a medical practitioner, a consultant, plastic surgeon from General Hospital Ikorodu, she will help us understand exactly what we call skin cancer, as well as how we can prevent skin cancer and some of the treatments, if at all, this occurs. So I crave your indulgence again to sit back, relax, be a part of this conversation on the issues today. I am Opayemi Adebambo, and do not forget that you can always listen to us from anywhere, all over the world via our website www.ikd1061fm.ng. Now, do not also forget to follow us on all social media platforms Facebook, X, and Instagram, where you can watch our broadcast live. Today, we talk about skin cancer prevention and the treatment. We go on a very short breather. When I return, I would introduce my guest to you from General Hospital Ikorodu. She happens to be the consultant plastic surgeon in person of Dr. Aliu Kadijat. She will be talking on skin cancer today. Again, I ask you that you please stay with us and be a part of this conversation. Good morning, Nigeria. You're welcome back to the issues on IKD 106.1 FM. Thank you for staying tuned with us. And like I told us today, we focus on skin cancer prevention and treatment. Do not forget that questions will be accommodated. All you need to do is call us on our studio lines 0904 1061 or 0904 1061, where our doctor guest, Dr. Ali Kadidat, will do justice to your questions. But before then, I would like to say good morning and thank you for joining us. Doctor, how are you doing today?
Very fine, thank you. Good morning, listeners.
Thank you for joining us, Dr. Khadija. Today we talk about skin cancer. I am very well sure that you know your onion so well, and with your beautiful profile as a consultant plastic surgeon with General Hospital Ikorodu, you are the best match for this conversation. So again, we say thank you for giving us your time today.
Yes, thank you for having me.
Let's talk about skin cancer, in its simplest context, so that everyone out there listening to you can understand. When we say skin cancer, what exactly is skin cancer? How best can you define the word skin cancer?
Okay, so you know that the skin is the largest organ in the body,
Yes, true.
and we need to understand what cancers are.
Mm,
So, what is a cancer? So, cancer is an excessive or a mass of tissue that
mm,
is whose growth is uncontrolled and is excessive,
mm,
and it continues in its excessiveness even after the factor that provoked it has been removed. And
mm.
then it then can spread through the blood vessels to
Okay.
reach other parts of the body where it can then wreak havoc and until it might even claim the life of the individual. So
Mm,
basically that's what cancer is.
mm. So when we bring it together, when we say the skin cancer, how do we put that together? Because people do not even want to. There are some people who would ignorantly tell you that there is nothing like skin cancer. We know of other cancers, but skin cancer we do not know. You know.
So as we have mentioned, cancers generally. So in the skin now, so skin cancers are abnormal mass of tissue in the
Mm,
skin, and
mm,
they it's very serious because it has the highest incidence of
mm,
all cancers. It even
mm,
exceeds that of breast cancer, prostate, colon cancer, all
mm,
combined. You
mm.
have more cases of skin cancer than any other cancer. But why this is interesting is because this is the most preventable type of cancer.
Wow.
So it's very important for people to know how this can be prevented so
Mm.
as to reduce the incidence of cancer in our society.
It is good to know that it is preventable,
Yes.
which is the very interesting part, like you have rightly said. Can we talk about some of the common types of skin cancer? Because I'm also aware that unlike other cancers that could just be one sided, skin cancer is a little bit different. There are types of skin cancer. So put us through some of the types of skin cancer.
Okay. So structurally, the skin comprised of two layers.
Hmm.
You can remember this from your basic sciences in
Exactly.
secondary school.
Yes.
We talk about the epidermis and the dermis. So the epidermis is the outer layer of the skin.
Hmm.
So most skin cancers arise from the epidermis. The epidermis has 5 layers.
Hmm.
So the layer that we call stratum spinosum, that is where 2 of the common cancers arise from. The one we call the basal cell carcinoma and the squamous cell carcinoma. So the last one is the most deadly cancer. That's the melanoma. So this is where the melanocytes are produced. This is the last layer of the epidermis. So it arises from the melanocytes, and the melanocytes are the ones that produce melanin. They're responsible for the pigments, the color on our skin. So melanin is very important because it helps us to prevent excessive ultraviolet radiation. It protects our skin. So unfortunately, if we anyway, I'll come to the causes. So basically,
Yes, we'll definitely talk about the causes.
those are the 3 main types, but the melanoma is the most deadly of all the 3.
So when it gets to that level, then it is very, very, you can tell that this is a big problem.
Yes.
How then can we identify, just like you said, we don't want to talk about the causes yet until we get to that bridge, we will cross it. But then when we talk about skin cancer, how then can we now say, unlike other illnesses, you can say, oh, you're feeling feverish, you're vomiting, this is what is wrong. When it's skin cancer, how can we identify skin cancer?
Okay. So skin cancers typically occur in areas that are exposed: the face, the ears, the hands, and feet. But it can also occur in other parts of the body. So typically they present as like an ulcer that has refused to heal. Might be on the face, might be on the ear. Sometimes it feels hard, nodular. Sometimes it heals and it comes back. So if this happens, and it can bleed also. So if this happens, one should be suspicious and one should seek medical intervention quickly. So typically that's how most skin cancers present. However, there are people who have a lot of moles that we call nevus on their body. So sometimes these moles can begin to change, they can transform. Like first they can become irregular in their borders. A mole that you have always had all your life, and you suddenly notice that it has become irregular, it's getting bigger, it's starting to bleed, or it's painful, then you should know that something has happened. Yes, so particularly the melanoma type is the one that arises from pre-existing mole. It can transform to become a cancer.
I do not want to call this a fallacy or mere assumptions by people, but I want you to clear the air because this is your area of specialization, where people would say that early in the morning it is good for your skin, to go and stay under the sun, the early morning sun, so that it will build your skin. And how true is this, talking about the skin? And they also say that it helps prevent skin cancer.
Well, that is not true.
Okay.
Yes, early morning sun is good because it helps our skin to synthesize vitamin D. But that is early morning. So anything between 10 and 4 p.m., then 10 a.m. and 4 p.m., then you are just exposing yourself to ultraviolet radiation. It's advisable to stay indoors between 10 a.m. and 4 p.m. If you must go out, make sure you use adequate sun protection, like wearing a sunscreen with a minimum sun protection factor of 30%, wearing a wide brim hat, wearing sunshades, long sleeve clothing and trousers. And of course, you can also use an umbrella. So if you must go out within these hours. So
you have to go through all of that. I was going to ask you the importance of sunscreen, but you've already said that people do not also see the importance of sunscreen. Put us through that and how it can help prevent skin cancer.
Okay, so for all the 3 skin cancers that I have mentioned, one common factor in their etiology is exposure to extreme levels of ultraviolet radiation. So this usually happens from childhood, but they tend to cause a problem when the patient becomes an adult. So it's important to protect oneself from the sun. It's not just about pigmentary problems or people who do skincare. It's not just about having a flawless skin. It also helps us to prevent skin cancer. So it's very important to use sun protection, the sunscreen. If you must use a sunscreen, you have to use it 30 minutes before you go out.
30 minutes before going out?
Yes, and you have to reapply it every 2 hours while you're out in the sun. So that's very important.
Let's talk about the causes now. I am very, very curious.
Host factors and environmental factors. The host factors are not modifiable. They are factors that we are born with, but the environmental factors are the ones that can be modified. First is the skin type. So in the black population, our skin type, using the Fitzpatrick classification, I don't want to go deep into that, is 5 and 6. But people with type 1 and type 2 skin tend to have a higher risk of developing skin cancer. So these people are light skinned, mostly Caucasians. They are fair. They have blue or green eyes. They have sometimes people with congenital nevus. So over the years, it can transform into become a cancer. Then personal history of skin cancer. For somebody who has had a skin cancer before, is at risk of having another one. Then family history. There are some syndromes that come with skin cancer that run in some families.
So skin cancer could be hereditary?
Yes, definitely. Then the male sex has a higher risk of skin cancer, slightly higher than the female sex. So for the environmental factors, these are the non-modifiable factors. The modifiable factors. These are the like the intense exposure to sunlight, like we have said, ultraviolet exposure. Then if one has had a history of blistering sunburn in the past, if you have had up to 5 sunburns in the past, then the risk is is elevated for that person. And exposure to chemicals like arsenic, hydrocarbon, people who work in factories whose skin are exposed to chemicals, they have a risk of having skin cancer. Then people who have had treatment for an ailment that required radiation. So radiation therapy can also predispose someone to having skin cancer. Smoking is a carcinogen for so many cancers. So it's also true for skin cancer. Smoking can predispose to skin cancer. Then there's a particular viral infection called human papilloma virus. This virus causes warts. So these warts can actually transform to become squamous cell carcinoma. So this can be a predisposing factor to skin cancer. And people who are immunosuppressed, this may be acquired, like in AIDS, acquired immune disease, and also people who have to be on immunosuppressive medication for some ailments, be it cancer from other cancers, or can also be as a result of organ transplant. People who do organ transplant need to be on immunosuppressive drugs. So this can lower their immune function and cannot predispose them to developing cancers. Then, of course, people who use skin whitening agents. I know a lot of skin whitening agents are out there now.
A lot of them. Yes, a lot of them.
So these agents contain things like hydroquinone, alpha-butene, kojic acid. This they reduce the melanin production of the skin. Like I said, melanin protects us from the ultraviolet radiation. So if the melanin production is reduced, the skin is more liable to burn from excessive sunlight. So this can cause cancer. So people who use lightning agents must remember to wear sunscreen to protect their skin. Then one other thing that is quite common in our environment is people with chronic wounds or chronic ulcers.
Okay.
You see a lot of people who have had ulcers or wounds for years and they don't do anything about it. So such wounds can become cancers if they don't take care of it.
So wounds could actually aggravate to becoming a cancer?
Definitely. If the wound has lasted for more than 3 months, it becomes a chronic wound. And anytime from then, it can transform to become cancer. So that's why it's advocated that if you have a wound, try to seek expert care so that wound can be healed, be it by medical treatment or surgical treatment, so that it will remove that risk of cancer formation.
While you were talking, if you're listening to us, we're talking about skin cancer today, how best it can be prevented. We will get there, and how it can also be treated. The good thing to know is that it can be prevented, like our doctor has rightly said. But you mentioned the fact that skin cancer could be hereditary. If the parents have this skin cancer, the child could also have. But now I want to also ask, talking about age, does skin cancer have anything to do with age? There are some cancers that will tell you maybe from age 40 to this age, there are tendencies that you might have this cancer. For skin cancer, does it have anything to do with age, or it cuts across every age circle?
Well, mostly affects the middle age, but can occur from age 15 to 65 and above.
A child as young as 15.
Yes, can have skin cancer.
That's serious.
But before age 50, females have a higher risk of developing skin cancer. But after age 50, more males have skin cancer than females.
How?
Well, that is genetics for you. I really, really can't explain.
Hmm.
Might be due to hormones,
Hmm.
you know.
So from age 15, there are tendencies that skin
Yes,
cancer
if the
could.
patient has a risk factor, be it
Mm.
familial or an acquired risk factor.
Let's also talk about parts that are not exposed in the body. You know, you talked about the spaces, the body parts where skin cancer could actually easily reflect. How about the parts that are not exposed? Are these parts also having tendencies of being affected with skin cancer?
Yes, because under melanomas, there are the ones that are amelanotic, that they don't appear dark. So those ones can actually affect any area. Can affect the oral cavity, can affect the genitals, can affect anywhere in the body, because those ones don't really depend on sun exposure or UV exposure. So it's true, because scientists have not been able to really explain why, how that happens, but they realize that some melanomas are actually amelanotic, so they don't really need UV exposure for them to occur. So they can occur in other parts of the body.
Not just the exposed parts alone.
Yes, yes, yes.
With your years of experience as a medical practitioner, let's talk about statistics now. How common is skin cancer in this part of the world? You know, there were times that while we were growing up, we know that that used to be a strange illness in Nigeria. But currently now, doctor, do you think skin cancer is very common in this part of the world, Nigeria, Lagos?
Well, I think we are lucky as Africans. Skin cancers are not so common amongst Africans compared to the Caucasians. In fact, skin cancers are 30 times more common in the whites than in blacks. Yeah. But in our population, we have a few people, a few people that have increased risk, like the albinos. The albinos, because their skin type mirrors, is similar to that of the Caucasian. They have defects with melanin production, so they cannot produce enough melanin to protect themselves. So these people have a higher risk than the general population to have skin cancer. So, well, we don't really have very good local statistics, but we know that skin cancers are not so common here as compared to the Caucasians. But the incidence is increasing now. It's increasing now, probably due to global warming, increasing temperatures. Sometimes in the north, you can have temperatures up to 45 degrees. So that's a huge risk factor.
For you right now, the way I see in the studio, definitely you're glowing, you're looking so beautiful and radiant. And I can tell that you're doing well with your skin, no doubt. The comparisons are different. You know, you're there talking and I'm looking at myself that what is going on? Why am I not this why am I not this fresh? Now, people want to be like you, and that is the reason why some people will go extra mile in spending so much to take care of their skin. And unfortunately, some of these treatments, some of these bleaching creams, and all of these things end up backfiring, so to say. How best can you care for your skin? And what will be your medical advice to people who go extra mile with chemicals, cream combos? There's a name they call this thing. I'm just trying to recall this common name.
Organic cream.
Thank you very much. Organic cream. What's your opinion as regards this so-called organic? Because when you look at them, truly, doctor, with all sincerity, they always look good. But the aftermath is not always very good.
Yes.
What's your advice? What's your opinion?
The truth about these chemical creams is that those who produce them, they don't even have any skill. They don't have the knowledge. They're not even supposed to be producing creams. Some of them don't even some of them are secondary school dropouts. If you say,
And they just want to get a job for themselves and
yes,
make money.
because they don't know the science behind what they are doing, basically. So they just mix things up, and when they realize that, oh, this can lighten the skin, they start selling it to people. They don't care about the toxicity of the product they are using. A lot of them mix all sorts of things. They mix steroids, they mix mercury containing products, hydroquinone in excessive quantities, not the quantity that is that's supposed to be in body creams or soap or whatever. So they go beyond the limit to make sure that people get light. They say they can whiten your skin in 10 days. They would lighten your skin in 10 days, but few months down the line, you begin to see sunburns, burns,
Mm.
and then the patient can begin to have exaggerated stretch marks,
Mm.
striae. This
Mm.
is caused by the steroid content. Some of them come down with kidney failure in future, liver failure because of the toxicity of the products
Mm.
that are in the cream. So I suggest that people go for reputable brands, well-known brands. Don't go for organic cream that you don't know what's the content. If you cannot read the ingredients
Mm.
on the label, then you shouldn't be buying such creams.
Mm.
Because they go beyond the expected limit in those things they put together. And of course they don't have the knowledge. They don't
Mm.
know the science behind what they're doing. So it's not advisable. We don't really need much to take care of our skin. All we need
Mm.
is to cleanse our skin, moisturize, and use sun protection. Basically, these are the three main things that we need to do. But now, as we age, maybe
Mm.
when we grow, when we get to 30, 40, 50, some other things will come in,
Mhm.
like using exfoliants, retinoids. So those ones will help us to stay glowing, looking young, and keep wrinkles away, at
Mm.
least for a few years
Mm.
before it becomes inevitable. At a
Mm.
point, no matter what you use, these things will come out because it comes with aging. So basically, I suggest that people stay away from
Organic creams.
yes, organic creams. They are very bad. They're not good for the skin. They
Mm.
damage the skin. They are not of any good.
Organic creams are not good for the skin. Now, another thing I want us to talk about before we even talk about how we can prevent skin cancer is the angle of makeups now to females. You know, you've helped us through how best we can take care of our skin, and you've talked about the three best formulas. Good enough, I don't even use cream. Maybe that's why I'm not glowing like you are, because I have this so much fear that my skin should not change. I just want it this way. Now, let's talk about makeups and all of these attachments. Far different from organic creams now. There are ways you see ladies and with the heavy makeup and everything. Does this also have any role at all to play in skin cancer, or makeups are just okay, they are fair, they're just makeups, you can apply them?
Well, makeups they don't really elevate the risk for skin cancer because
Okay.
all they do is they could clog pores and they can make the person have breakouts, acne breakouts,
Mm.
but not really a risk factor for skin cancer.
Mm.
No, it's not.
Mm.
Except, of course, if the product is toxic in itself, because some makeup products contain mercury,
Mm.
contain all sorts of harmful chemicals
Mm.
that should not be used.
Mm.
So it depends on the brand that the person uses. But makeup in itself will not be a predisposing factor to skin cancer.
So that is still on the safer side
Well,
to some extent.
yes.
There is, somehow, with what you have said, I know organic cream makers out there will be looking for you. Yes, for the fact that you said they should not be patronized. Now, I want to put you on the hot spot right now, because you've done same with organic cream makers. We have medical practitioners who would put you through skin wash. I don't know what they call that thing medically. They put you in a machine and then you wash your skin, boom, you come out, you're looking all white.
Wow.
Now that is done by medical practitioners to wash the skin. We've heard of rumors of major celebrities in the entertainment industry. They go dark, they come out white. What do you have to say to something like this? Is this also okay, or this is also opening doors for skin cancer?
I'm not.
You will not say you are not aware.
To be honest, I'm not aware. Those who do those things, they are not medical practitioners. They are estheticians.
Oh, okay.
Estheticians are not medical practitioners.
Mm,
Some of them, they own a spa. They do all these things in a spa
Okay.
parlor, not in a hospital.
mm,
You won't find a medical practitioner doing all those things because those things are not safe. They give all sorts of things intravenously. They inject glutathione, which can lighten the skin from within.
Exactly,
It's
exactly.
going to have implications,
Mm,
whichever way you look at it. So, medical practitioners don't do that. They are estheticians. Some of them are poly trained, some of them are well trained. But a lot of times they don't know their limits. They go beyond their limits.
mm.
So I wouldn't advise anybody to do such.
All right, we would accommodate questions if at all you want to ask my doctor guest questions today as regards skin cancer on 0904081161 or 0904082161. This is about the time where we need to talk about prevention. Prevention, they say, is better than cure.
Right.
Definitely, it is good to know that it can be treated. It could be treated. But before then, if it can be prevented, why allow it occur? Let's talk about the prevention of skin cancer. How can we prevent skin cancer?
Actually, we've mentioned a lot of them
Okay.
earlier,
Mm.
like using sun protection,
Mm.
wearing the sunscreen, moisturizing sunscreen with a minimum sun protection factor of 30%. So this
Mm.
blocks the UVA and UVB ultraviolet radiation. They are
Mm.
type A and type B. So this can actually filter away the ultraviolet radiation.
Before you go ahead, let's take this call. This call has been coming in. Yes, hello. Good morning. Thank you for calling. Thank you for calling. Mm. Go ahead. Thank you. Thank you. Mm. 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 Thank you. Thank you. God bless Nigeria and God bless you too. Thank you very much. There's our caller. I don't know if you have something to say to that, Dr.
Yes, it
Khadija.
actually does have a point.
Mm.
You know, earlier I mentioned immunosuppressed, immunocompromised states as a
Mm.
risk factor.
Mm.
So malnutrition will actually put a patient in that immunocompromised state. So
Mm.
he has a point. If somebody is malnourished, he will be immunocompromised and you'll
Mm.
be at risk of developing skin cancer.
True.
But it doesn't directly cause skin cancer, as we know. So
Mm.
we need to take proactive steps in protecting our skin.
Mm.
Just taking balanced diet and going out in the sun will not protect you.
Mm-hmm.
So you still have to protect yourself when you go out in the sun.
Let's go back to our preventive measures of skin cancer.
Yes, so we said that sunscreen should be used.
Mm.
Avoid going out between 10 a.m. to 4 p.m.
Mm.
That's the peak period when the intensity of the UV is maximal.
Mm.
So you should stay indoors if you can. If you can't stay indoors, when you go out, wear wide brim hats, use sunshades, wear long sleeve clothings, and then you can use an umbrella. Then we said you should quit smoking if you smoke.
Mm.
Reduce smoking, avoid exposure to chemicals, and also most importantly, regular screening. Screening. If you notice any abnormal mole that has changed in recent times,
Mm.
make sure you see your medical practitioner. You can see your general practitioner who would examine you. If it feels like it's suspicious,
Mm.
they can then send you to a specialist, a dermatologist, who is a physician that is an expert in skin conditions.
Mm.
So the dermatologist would now, if it's a suspicious lesion, he can take a biopsy, which means that he takes a sample from that mole
Mm.
and send it to the lab. The pathologist would evaluate it, look at it under the microscope. If it's a cancer, then such a patient can be sent to us. So the plastic surgeon would perform a surgical excision to remove that cancer.
Let's take another call. Hello to you. Thank you very much. Good morning for calling. Thank you for calling. Yes. Your name and where you're calling us from, please. Please go ahead. Mm. Mm. Mm.
I want to say also this um type of diet that are suitable for the skin.
Hmm.
Not to avoid not for malnutrition, not to cause skin cancer. Some diet, some
Healthy diets for the skin.
some food. I want you also to give us some
All right.
as like God bless you. Really, really important.
Thank you very much, and God bless you too. Okay, we will get to that, but let's get done with our preventive measures first. But what he's asking is, okay, if at all diet is also part of ways to care for your skin, what are some of those diets? But before we get to that point, let's call it off with the preventive measures first.
Okay, so the last part is what I was actually talking about, the screening. So
Mm-hmm.
screening is the last part. So it's important to self-examine once more. It's normal to have moles,
Mm,
and normal adults can have up to 10 to 40 moles all
mm,
over his body.
mm,
But when the moles start to change, is when one should be worried.
mm,
So when you look at it, you see that the thing is no longer as rounded as it used to be. Now
mm,
it's asymmetrical. So you should be worried. There is irregularity of the border. The color now varies. Maybe some areas are appearing black, some ash, some brownish. You should be worried. Then if the diameter has increased, like it's more than 6 millimeters,
mm,
you should be worried. And it's evolving.
mm.
It keeps evolving, it keeps changing every day. Then you should know that something might be wrong and you should seek medical intervention.
Talking about self-examination for skincare, it is very rare for, I do not know if it is, but I'm thinking that someone might not just want to stand up from home and say, I'm going to the hospital. And then maybe the children ask, Daddy, what are you going for? I want to go and check my skin. It could sound, at what point can anybody just say, I want to go and seek for medical advice as regards my skin? At what point is it advisable? Sometimes for our diet, they will tell you every 3 months, you come for this, for your teeth, your eyes, you come back every 6 months. But for the skin, is there a routine? Is there a particular duration to checking of the skin?
Well, not necessarily.
Okay.
If you have, as somebody that doesn't have so many growth or moles on your body, you
Mm,
don't really have to. But if you're somebody who does, you have to examine them by yourself. At least you know what they look like.
mm,
So when they begin to change, that is the point where you should seek medical intervention.
mm,
Then also there are some group of people that have increased risk of
mm,
developing skin cancer, like albinos. Albinos have a lot of lesions on their skin because of sun damage, sun exposure. So when those lesions begin to transform,
mm.
albinos should actually have their screening like annually. They should have
Annually.
screening by a physician annually or a dermatologist.
Mm,
Then people who have a family history of skin cancer should also have regular skin screening like
mm,
annually. Then those who have had a previous history of skin cancer that was treated,
mm.
they are at increased risk of having another one. So they should also do an annual check on their skin.
I almost forgot, how deadly can skin cancer be? How deadly could it be? Is it could it get to the point that it will take life, or it is something that, okay, it will just be there until you know
Mm.
how
So,
deadly is it?
we mentioned three earlier. There's one where we call basal cell carcinoma.
Hmm.
That is the one that has that is the most indolent of them all. It's not that aggressive. It's rarely metastasized. Metastasis means that when the tumor travels from one part of the body
Hmm.
and is disseminated through the blood or through the lymphatic channels to another part of the body
Hmm.
where it settles and begins to grow. So the basal cell carcinoma rarely does that, and this is the type that is common in albinos. So it's just most times it presents as a nodule on the face, on the ear, on the nose or upper lip,
Hmm.
and it just remains there. It's slowly increases in size. Usually the center is depressed and there is might bleed.
Hmm.
It might even be painless, usually painless.
Hmm.
That one rarely metastasizes, but can cause a lot of local tissue destruction.
Hmm.
Like if you leave it untreated, it can even destroy the whole of the nose. It can erode into the eye. So that one rarely metastasizes. So it's not very dangerous.
Hmm.
So coming to the squamous cell carcinoma, so this type is also, let's just say, is borderline. In its own case, if it's left untreated for a long time, it
Hmm.
begins to metastasize.
Hmm.
It can metastasize to any part of the body. It can go to the brain. It can go to the lungs. It can go to the spine.
Hmm.
So where it can now cause problems. So a seemingly innocent skin lesion can become something life-threatening if it finds its way to the brain or the lungs or another parts of the body.
Mm.
So the most deadly is actually melanoma. Melanoma is accounts for only 1% of all skin cancers. It's not common, but it accounts for 75% of deaths from skin cancer. So melanoma should, if picked early, it's very treatable.
Okay.
Because the staging of skin cancer, we stage it from 0 to 5. I don't want to complicate this discussion. But the lower the number, the better, the earlier, the better the prognosis. If they tell you, oh, you have a stage 5 disease, it means that it's already metastatic. It has spread all over the body. If they say you have a stage 0, 1, 2, it's still very treatable. If the patient presents early, it can be treated with surgery or other modalities, and the patient will be fine. The patient can be completely cured. So this is why early presentation is very important.
Thank you. Hello to you. Who's on the phone line? Thank you, Femi Farms. Please go ahead.
Sorry, I have a question for our guest. Good afternoon.
Good afternoon.
Please, how can less privileged people that are not more wealthy, how can they manage their skin? That's number one. Then I noticed something. Those people traveling out, no matter how wretched, no matter how poor we are, you can't even compare them with us here. And then something earlier compared to confinement ages, that no matter how rich you are, there's some certain stage you cannot be able to, no matter how much you use, you can't even you can't even see the effect on your body. It looks scary normal. So I need more clarification on that.
All right. Thank you, Femi Farms, for calling. This person is asking the question that what is the cause of whenever she travels, there is always a water reaction. She uses water, the skin is reacting to the water. The people in the environment, the water is not reacting to their skin. When she goes home, it is not same. And it happens anytime there's a change of environment. Our first caller also talked about the diet, that you need to eat to have a good skin and to live healthy. And the third one from Femi Farms talking about how can the less privileged, the masses care for their skin too as well. So I think you need to take them one after the other.
Okay. So the first one is talking about reaction.
Yes,
skin
water reaction.
whenever-
Yes, skin reaction on water.
Now, I don't know where this person has traveled to, so I really can't say. The person traveled abroad, the person traveled to another city within Nigeria. I don't know. So basically, there are so many reasons why one might react to water. Might be because probably the chemicals used to treat the water. I don't know what kind of water the person is taking, but if it's somebody that has traveled to another country, might be a difference in temperature, change in temperature. In our own environment, there's no winter, fall, summer, or whatever. But over there, if you are used to this environment, if you go to a very humid environment, your skin can actually react with breakouts and all of that. It might not necessarily be the water. Might not necessarily be the water.
Shoni Barre, you might need to clarify that question. If at all, you will still send again before we get done with the show. So let's go to the second one.
The food.
Yes.
Okay. So concerning the food, a general balanced diet is good. Taking carbohydrate, proteins in balanced proportions. But more importantly is taking leafy vegetables. One can take a lot of carrots. Carrot is good for eyesight, but it also helps. It has vitamin A, which also supports the skin. Then you can also take avocado. Avocado is very rich in omega-3 fatty acids. Omega-3 fatty acids is known to help the skin to glow. It pumps the skin. So then importantly is hydration. Taking a lot of water, staying hydrated is very important to keep our skin healthy. But all this will not directly affect our skin if we don't take proactive measures. Sun exposure, limiting sun exposure is the main thing. So that's one should be proactive about that. Avoid going into the blazing sun without protecting yourself.
All right, and then I think that settles all of the questions. Talking about the treatment now. Which I am very much interested on. First off, they will tell you if you have skin cancer, forget it. Just go and be praying to God. It is very expensive. You can't even afford it. They will need to tell you to fly outside the country. And all of these things could be very scary. How affordable is it to treat we've talked about how it can be prevented, but yet still we have people who are out there who are suffering from skin cancer. How expensive? Maybe we should take this call. Hello.
Yeah, strategically,
Hmm.
the prevention is better than cure. You know, as I get my experience of food malnutrition, all experience is absolutely so bad. The biggest people prevent me from prevent my life to farm. So to what extent, and that is God. So in no condition of person like me. And when I went to the northern region, I see the poor level of living there. They eat rice with only salt. And also they spend serious danger damages to their woman, all the system, memory, reproductive system. I don't know the condition of my reproductive system as a result of this core experience now. The only when I put so money, and when I know. Many people of Africa have been doing is their reproductive system, in the sense of gender, have been totally destroyed with preventive food malnutrition. So we need to acknowledge the dangerous effect. For me to have a very good government, Palestinian government that will care for the workers' salary. And 70%, 70,000 naira is nonsense.
Thank you very much. Thank you. God bless Nigeria. Thank you very much. We definitely understand your plight. We know where the energy is coming from. And like you have said yourself, God bless Nigeria. Okay, I would take that call when it comes in again. How affordable? There are a lot of calls, and the questions are not. Okay, maybe we should finish these questions first. How affordable is it to treat cancer in Nigeria today?
Okay, so treating cancer depends on the stage.
Okay.
If the patient presents early and it's still within the frame that one can cure the cancer with surgery alone, that is usually very affordable. If the cancer has not grown beyond the original primary site, if it has not grown to a secondary site like the lungs, the brain, or the gut or spine, then it becomes more expensive, it becomes more complicated. If a patient presents early, surgery alone is enough. All we have to do is remove the cancer and some of the surrounding skin, and sometimes we have to replace the skin. We transplant new skin to that area.
A skin could be replaced.
Yes. We call it
Wow.
skin grafting. We just graft it and the patient will be okay. No further treatment will be required. All the patient needs is a regular follow-up to know when there is a recurrence or anything. But if a patient presents when there is already spread to the lymph nodes or spread to other areas, the patient's treatment will not be limited to only surgery. Yes, surgery will be done to remove that primary lesions. But note that there are now secondary lesions in other parts of the body. So that one cannot be treated by surgery. You cannot go and plug somebody's liver, brain for metastasis. We don't do that. So what we can now do is to use what we call chemotherapy. And that is where the cost comes in. Chemotherapeutic drugs are quite expensive. So it depends on the type of cancer the patient has and the duration of the treatment. So that will determine how much it costs. But straightforward skin cancer that has presented early is quite easy to treat.
It's quite easy and affordable.
It's affordable. Yes, I would say quite affordable also.
Okay, you talked about something earlier when you said, I don't know if I heard you correctly, where you said that there are tendencies for someone who has actually had skin cancer before to have it again.
Yes.
I would need you to clear the air on that, because you just said that it could be treated and that's it. So there are tendencies it could still come back.
True. Sometimes when we see them and we stage them, the staging might not be accurate. If you see somebody and say, this is a stage 1 cancer because of the size, maybe it's just 2 cm, and you have cut around it, you have done everything. 5 years down the line, the patient can come back with a cancer at another site. And it's showing that this is a secondary cancer arising from that initial one. That means that some micrometastasis has even occurred at that time. So it's possible for metastasis to have occurred while it's looking like it's still confined to the primary location. So it's possible for metastasis to have occurred. Or it might not even be metastasis, it can be another primary lesion in another site. Since the patient has had the cancer before, his risk is increased more than the general population.
We want to thank you so very much for your time. Before we leave, now let's talk about skin cancer. How contagious, or is it even contagious? Maybe, for instance, in a home of 4 that the father has skin cancer, are there tendencies that because he has it, or even at a workplace, let's even, family could be, you said it's hereditary. When you have people around you that has skin cancer, or someone has skin cancer where there are other people, is it contagious?
No, cancers are generally not contagious. It's due to a genetic mutation within the person. It's not due to it's not found in body fluids or whatever that anybody who comes in contact can pick up. Is within that individual, is within the genes of that individual, so it cannot be transmitted like that. So unless that person also had a mutation like damage to the DNA, and something causes abnormal growth, probably due to any of the risk factors, smoking, exposure to radiation, or exposure to ultraviolet rays. So that's the only way. But by just physical contact, no. Cancers, skin cancer and other cancers cannot be contracted like that.
All right. Thank you very much for your time. While you're going to be setting out to go ahead with your medical jobs, what would be your advice to everyone out there who has heard you today as a consultant for plastic surgeon? What would your advice be to everyone out there?
When people are young, that eventually leads to problem in the future. So because a lot of times children just go into the sun, play and all of that, but the damage is usually not reversible. Even if they now take steps to protect their skin in future, but the damage they have had as children is what predisposes them to cancer, because that is where the genetic mutation takes place and it now stays so many years before it's manifests as skin cancer. So let's learn to protect our children from excessive sunlight exposure and start a skincare regimen for them. You can buy them sunscreen, particularly when they are coming back from school. They should have an umbrella. They should not be walking under the blazing sun. They close from school between 2 and 4, and that is the peak period. So we should learn to protect children, and we should also learn to examine our bodies. Don't leave any if you notice anything abnormal, go to the hospital. Let a physician examine you and tell you that okay, everything is okay. If the physician is worried, he can also send you to do a biopsy to confirm whether it's cancerous or not. So basically, that is my advice.
Like I always ask many of the medical practitioners from General Hospital, if you have reactions or you're feeling suspicious, something might be wrong. How does it work with General Hospital Ikorodu? Are the doors open like 24/7, or there are days at which you can only come on Tuesdays or on Thursdays or on Wednesdays?
If you have concerns about your skin, there is the general patient unit is there for you every day of the week, Mondays to Fridays, so 8 a.m. to 4 p.m. Because skin conditions are not usually emergencies, but if you think it's an emergency, you can walk to the accident and emergency unit anytime. But usually for a consultation, Monday to Friday, 10 a.m. to 4 p.m., you see a doctor who will examine you. It's usually a general practitioner. If the doctor is worried, he now sends you to an expert for further treatment. So there's no limitation. Anytime. If you think it's something that is really urgent, just go to the emergency room. You'll also be attended to.
Thank you so very much, Doctor. Yes.
In addition, I wanted to talk about the chronic ulcers. People who have old wounds on their leg. Please, I know that people think, oh, it's expensive. Some people think it's a spiritual attack, it's an arrow. I'll just be treating it. I don't want to go to the hospital. A lot of times, these ulcers are treatable. Some people carry their ulcers for 10 years. They're thinking that, oh, somebody is behind it. But when you come to the hospital, we find out that, okay, this is the cause and this is the treatment. It's actually very treatable. So don't wait until it becomes cancer. So it's important.
Ulcer is treatable?
Yes, definitely. Leg ulcers, all sorts of ulcers, they are quite treatable. And patients who have had burn injuries before, who have burn scars on their body. If you notice a sudden ulcer or wound on your burn scar, and it's not healing, please seek medical attention, because a lot of times those old scars can develop cancer. That's why the fact that they have healed, if sometimes even 30 years later, they'll just develop a sore that they think is an innocent sore, but it's actually cancerous. So if you notice anything, early prevention is very important, because that's when we have the chance of cure. If they present late, we might not be able to do much.
Thank you very much, Dr. Ali Kadijat from General Hospital Ikorodu. This is how far we can have it today. Thank you to every one of you that has called in. Thank you to those of you that followed us on our social media platforms. We apologize. We can't take in any more calls. Our time is fast spent. I am Opeyemi Adeban, but remember, your health is important. Health is wealth. And while you talk about your health, your skin is part of this. And to everyone out there too as well, please always remember your children are also very important. While you take care of yourself, Take care of your children too as well. God bless Nigeria. God bless Lagos. God bless every one of you out there. And of course, thank you again to my doctor for doing a good job this very beautiful day.
Thank you so much for having me.
Thank you very much.